So a typical thing that you're going to start to see with overhead athletes and specifically throwers is after we go into max external rotation or layback, when we go through pronation, acceleration, deceleration, right, you're going to notice that as we pronate, we're internally rotating the humerus, which is the bone that connects into the shoulder socket, and this bone also forms the elbow joint. What happens is when we go through pronation, deceleration, we're internally rotating this humerus. Humeral torsion occurs, and humeral torsion is a distraction force. So basically, if we didn't have the muscle tendon units and the passive connective tissue, from the act of throwing, because of the violent movement, we would throw the humerus out of the ball and socket of the shoulder. So that's why when we're looking at overhead athletes and they're starting to get any elbow pain, we have to understand, well, why is the elbow pain occurring? And we have to understand that the elbow joint is a hinge joint, meaning it's only for flexion and extension. And you'll see that the humerus and the ulna and that radius are going to form to develop this medial epicondyle. And so, again, like what's the only thing that's holding in between to dynamically stabilize the arm in layback and that valgus torque is the UCL. So again, you have a ball and socket joint dictating a hinge joint. Because when we go into pronation, deceleration, and we're internally rotating that humerus, you'll start to see actually that throwers will start to develop more of a internal static position of the shoulder. And if they do a test like this, you're going to notice that the throwing side won't get as much supinated than the non-dominant side, and that's a good way to tell, all right, hey, the displacement of the humerus relative to the ulna bone, that's where you start to see the torsion happening in that joint, and now the UCL has to hold a little bit more stability for the torque on those two bones. And that's kind of the trickle-down cycle to, little league elbow, growth-plate injuries, or that typical golfer's elbow, or the tendonitis. But again, it's looking at, well, why is this happening, okay? We can't treat the symptom, we gotta look at the cause, and looking at that from a biomechanical standpoint is really key as to why we do, positional isometrics, hitting the weight room, controlling upward rotation, downward rotation, protraction of the scap, even retraction. So again, there's a lot that goes into this, but again, the question always becomes, well, why? So that's one of the things that we implement here at BSF is, the positional isometrics and making sure we're keeping good integrity of the entire kinetic chain.